Hello, everyone. I'm Dan Limbach from PharmaVoice, and I'd like to welcome you to today's event entitled Designing and Measuring Engagement in Behavior Change Interventions, brought to you by PharmaVoice in partnership with our good friends at MadPow. We have an outstanding crowd today with executives from across the industry. We have a very knowledgeable pair of experts with us today to explain the latest techniques for designing patient engagement and measuring that engagement in behavior change interventions. Based on the outstanding turnout today, it's clearly an area of interest, and it promises to be an extremely informative session. I know I'm looking forward to it. We're very happy to welcome Dustin DiTomaso, Senior Vice President, Behavior Change Design at MadPow, and Dustin is joined by Aidan Hudson-Lepore, Behavior Change Designer at MadPow. Dustin is going to start things off, and we'll also hear from Aidan. We'll have a couple audience polls, and finally, we'll have some live Q&A. Dustin, you have the floor.
Great, thanks, Dan. Welcome, everybody, and thanks so much for joining Aidan and I today. It's a topic that we think about and apply very often in all of the work that we do, and it's an area that is rich and complex. So there's a lot of insights in thinking that we've pulled from research or that we've learned over the years when thinking about engagement, and we want to share that with you all today. We've broken the talk down into a couple sections, thinking about how to conceptualize or think about engagement, to create a vocabulary that we can all share when we discuss engagement and what that means. We'll talk a bit about how to design for engagement, and again, with measuring engagement, what kinds of metrics or indicators might we use to identify to what extent people are using the products, services, or interventions that we're designing, and of course, we'll take some questions. To kick things off, though, let's start with a poll. What is engagement? So for folks on the line, do you think that a synonymous term for engagement would be marketing, experience, behavior, potentially all of those, or maybe none of those and something different completely? Please take a moment.
Okay, so those of you in the audience, you can select any of these 5 answers by clicking on the circle to the left of your answer, and we'll give everyone a moment to give us their opinions. So big leader, all of the above. Dustin, do you want to comment on these results?
Yeah, this is looking good to me. Yeah, we would think about it as all of the above as well. We'll talk about what we hear from clients. In particularly, we're going to break it down and narrow it to look at both experience, subjective experience, and behavior, particularly as a combination. But this is good. So that idea of engagement, and when we work with different clients or even internally with different teams, what do we mean? Right? What do we hear when we talk about engagement? And very common, we hear statements about, of course, clients, we want to improve our engagement. Patients aren't using our product, right? They need to be using it. How can we get more patients to use it, right? Increasing the reach of our products and services, so more people have access and more people are utilizing what we design. How do we get patients to use it more often, right? Increasing that frequency, right? That kind of measure. And how do we keep patients using it over time? Very often, forever, for better or for worse. We can think about and talk about disengagement and how long. And how to think about, is forever, the right idea? Or when we think about digital therapeutics, behavior change interventions, is there a termination point? And what makes sense for thinking about termination as an endpoint with the tools that we design? And we hear these things, of course, because we may want customers or patients to have our brand on top of mind at all points. We think that it could increase revenue. Patients might do the marketing for us through social media. Very often in business stakeholders that engagement is certainly a KPI that's being tracked over time through the use of analytics, and very frequently the operating assumption is that more engagement is better, right? Always more engagement. And we're going to challenge that a little bit today to think about why, while these things are certainly relevant, a different way that we frame the goals and the outcomes in order to design meaningful products and meaningful outcomes of engagement. And we frame it this way, right? So if we were to put a statement together to say why engagement, why is that important? We think about it in this term, right? We want to improve engagement with the digital tools that we create, because effective engagement with a digital behavior change intervention can support behavior change, right? The engagement and the usage of the tools that we put out in the world are linked, right? They need to be used in order to be effective. And behavior change, when we talk about effective, it's about the positive outcomes for patients, right? So those could be clinical goals, those could be well-being or psychological goals, those could be behavioral goals and outcomes, and those could be patient-focused outcomes as well. So we want to be able to link outcomes to behavior change, to engagement with the tool, right? And that kind of structure is what we focus on when we think about engagement. And in the pharma industry, we can think about it, a few of those goals being helping people to find an appropriate therapy, thinking about adhering to that therapy as prescribed, and of course, remaining on the therapy over time. And these are, pharma industry-based goals that all have engagement at the core of these statements. So we're on the same page. When we use the term DBCI, or digital behavior change intervention, it's a bit of a mouthful. What we mean is, really any digital products intended to change behavior in the real world. That's away from the screen, and I think this is an important framing. We create digital tools, digital services, applications that people interact with, but those main goals are to change behaviors off the screen. For example, we could think about taking medication, right? If our goal, behavioral goal, is to help people adhere to a medication regimen, they're taking those pills out here in the real world, or injection, or whatever it might be. But the digital therapeutic is aimed at helping them to increase that adherence. And you can follow that through and imagine that for things like increasing exercise, improving sleep, dietary behaviors, anything like that, right? We want those behaviors to happen in the real world. And when we think about these DBCIs, we're not so much thinking about typical sort of marketing or agency kind of behaviors like increasing sign up, or overall time spent on a platform, or checking out products, right? We're really concerned with what happens in the real world in order to receive the therapeutic benefit. Aiden?
Yeah, thank you, Dustin. So to add a little bit more clarity, or to help further explain this idea of how this digital intervention can result in real-world outcomes, we like to think of it as a causal chain, right? Engagement with the on-screen with the intervention is necessary to deliver the active ingredients of the intervention. So what you as the designer think is going to be necessary to support someone in changing those offline real-world behaviors. And ultimately, it is that change in those real-world behaviors that results in outcome effects. So what does this look like in the real world? Well, if we think of an example of rheumatoid arthritis, one thing we might want to encourage is for patients to adhere to their medication as prescribed, so that they can have improved condition management, better quality of life. They're not in as much pain. They can do the things that are important to them. And one way that we might want to explore that in an intervention is to support tracking of their medication and their doses and timing, and making sure that that is following adherence. So in designing a medication tracker, That is providing instruction on when the appropriate time and perhaps the appropriate way to take their medication is, but also is helping provide an avenue for self-monitoring that behavior. Over time, did I actually take my medication in the way and timing that was expected or that I'm supposed to? And being able to compare that real-world behavior with what has been tracked digitally, we've seen in behavior change literature, can be a very effective method for changing behavior and ultimately getting those improved outcomes. So one thing we do really want to highlight here is when designing interventions, given that we are working on what that, in this context, a digital tracker, right? What's happening on screen is the thing that we can most directly measure, but it's absolutely essential to keep in mind the outcomes that patients care about, right? Their goal is not to adhere to their medication. What they're hoping for is to have this improved quality of life, to be able to do what they care about. And as we're designing interventions, we really want to be keeping these two things in mind. What is the goal of the intervention, or what needs to happen for those positive outcomes to occur? And then what is that outcome that we want to make sure is kept immediately front and center in mind for the patient as they're doing the work, and it usually is work, to engage with a digital behavior change intervention. Whether it's something like tracking doses of medication, that's something that people are going to have to engage with daily for a long amount of time. And I think any of us who have engaged with a tracker or that sort of app, we know that it takes effort to sustain over time. So we want to make sure that it continues to be worth it for patients. So we talked about in the beginning of this presentation about how we think about engagement and how we can define engagement in the context of digital behavior change interventions. So engagement can be a subjective experience, a cognitive, emotional, and motivational state. It emerges during these interactions with a behavior change intervention. So while someone's actually looking at that screen, what are the emotions that come up with the actual behavior within the intervention itself? Or on the flip side, when they're doing these offline behaviors that we're hoping to encourage, what is their experience with that? And when we talk about in the intervention being engaging in this subjective emotional experience way, we often think about it as a state of focused attention or interest and enjoyment, some sort of positive emotion or getting lost in a task. So oftentimes a lot of health behaviors aren't necessarily easy to associate with this positive engagement or a behavior being enjoyable in and of itself. But if we're able to aim for that sort of engagement, that's something that we absolutely encourage. But what we really want to focus on in this webinar today is thinking about engagement as a behavior. Specifically, engagement can describe the extent of digital behavior change intervention usage and on-screen and the execution of these offline target behaviors over time. We often refer to this as a dose obtained by individuals or adherence to the intervention. Is someone performing these digital behaviors that we think is required to produce the off-screen outcomes, and is someone performing the real-world behaviors that the digital intervention is meant to encourage? And this is engagement. And also, we want to point out, given we're talking about digital interventions, in the human-computer interaction literature, longer periods of engagement has been described as stickiness, endurability, and thinking about engaging in multiple sessions over time, and how good is engagement in the long term with an intervention. So, in short, for digital behavior change interventions, these digital interventions need to be used to be effective, and then real-world target behaviors need to be performed in order for outcomes to occur. Seems like a statement of the obvious, right? But something that we see in digital behavior change interventions are different types of engagement patterns. And if we just look at what's happening on screen, sometimes it's difficult to interpret whether the intervention is effective or not. So for example, a common engagement pattern we see is single login, single sign up, and then no further engagement over time. Oftentimes, we'll also see a sudden intense peak of engagement followed by equally dramatic drop-off. Or we might see what can seem like an unpredictable pattern of engagement and disengagement and re-engagement with this digital intervention over time. So something we want to hear from you all is, if this measures on-screen engagement, and you see these three different patterns, which line do you think represents the best engagement pattern? that corresponds with the most effective intervention.
And let's share the results. Okay, so red is our winner, but none got a lot of love also. What do you think about these results?
I think this is quite interesting, and I'm actually excited to see such a range in answers. So I think as we see by the range of answers, it could be any of these, it could be none that represent effective off-screen engagement. More on-screen engagement doesn't necessarily mean better outcomes out in the real world. So if we think about this yellow dot, right, it's possible that someone got what they needed to change behavior within one session. They saw content that was particularly motivating. They were exposed to a strategy that they decided to go out and apply in the real world and successfully changed their behavior. But all we see on the on-screen end is one sign-on and a drop-off. And then on the negative side, it's possible that someone signed up, didn't see the value of the intervention, and then just never returned, and their off-screen behavior didn't change. For the blue line, the sudden intensive engagement followed by a drop-off, it's possible, again, that someone needed to practice skills within the context of a behavior change intervention, and then was able to maintain them over time without needing the support, like without needing sustained tracking, without needing additional content and advice. They got what they needed, and then they succeeded in changing behavior. Or it's possible, again, that someone tried out the intervention, played around with it a bit more, and then lost interest and didn't change their behavior. And then red, which we saw was a leader in some of the guesses, is, again, hard to predict. It's possible that someone is using the digital behavior change intervention, quite a mouthful, as expected and as needed to support having a hard time initiating and sustaining target behaviors over time, but they're coming back to the intervention and they're getting the support they need to ultimately end up succeeding in these offline behaviors. Or on the flip side, the intervention just wasn't effective at helping them build the habits they needed to sustain this off-screen behavior, and they needed to keep returning to the intervention but weren't really getting anything out of it because what was taken as the active ingredients in this intervention didn't actually end up being effective for them. So when we talk about the context of effective engagement, like, right, what we're here to talk about in this webinar, there is this underlying assumption that more or greater usage is optimal, and that's not always true, right? The relationship between usage, like even just in terms of real world behaviors, let alone the interaction between digital and real world behaviors and real world outcomes in the healthcare space is complex. But we know that there's growing consensus around the need to identify and promote an effective level of engagement with digital interventions to create these positive real outcomes for patients that we all care about. Which leads us to the key question, right? Which is how much engagement is enough? And how do we know that people are engaging enough with our intervention to reach their desired outcomes? So when we think about effective engagement, it is sufficient engagement with an intervention to achieve desired outcomes. What is happening with the behavior, and then how does that relate to clinical, financial outcomes, quality of life, anything that we might try and help patients promote. And what we need to know when we're thinking about designing for real-world behavior change is a plan for what is our expected engagement with the digital intervention itself, this blue line here on the slide. What do we think is the on-screen behavior that is necessary in order to translate to this real-world target behavior, what's lined in orange? And then ultimately, how long do we think someone needs to kind of marry together the digital intervention and the digital actions and the off-screen behavior in order to ultimately be able to engage in that off-screen behavior without needing the digital behavior change intervention for support? So an example of what this might look like, again, for arthritis is we would anticipate for a while a pattern in the beginning where there isn't necessarily off-screen behavior being performed. Someone needs to sign in to this medication tracker, for example, and just get familiar with how to use it. What is the logic? What is some of the motivation behind why tracking medication is important? What kind of outcomes they might anticipate? But then ultimately, if people start tracking their doses, taking their medication as prescribed, these target behaviors out in the real world is medication adherence. but some of what we might provide in the digital intervention is not only the ability to track the doses of a medication, but also potentially to track symptoms, the ability to read content about symptom management and how to improve quality of life with arthritis, right? What kind of support can we provide that ultimately helps someone manage their condition better? And in this case, right, we might expect this pattern of engagement that we've outlined here in blue might follow that blue line that we had in the graph earlier of a sudden strong increase in engagement followed by a sudden drop-off if someone was able to get in that habit of taking their medication as needed pretty quickly. And so in this case, if we're only looking at the digital actions, the engagement with the digital side of the intervention, we wouldn't necessarily know whether the intervention had been a success, which is why when we're thinking about designing for effective engagement, we also need to have the ability to measure desired outcomes in individuals out in the real world, in addition to the on-screen behavior of the individuals, right? So what's happening on screen, what's happening off-screen, and then do those off-screen behaviors relate to ultimately to the outcomes that we're hoping to encourage? And what we need to design for is a clear understanding, right, of how does that blue bar of digital interaction relate to that orange bar of actual real world behavior. And our hope and our intention and what we advocate for and what Dustin will be discussing as well is how do we create an empirical theoretical grounding of this intended use that connects the digital intervention to this off-screen behavior. So I will hand it over to Dustin now.
Great. So as Aidan alluded to, we think that the key is to be focused on measuring both outcomes, measuring the behaviors both in the real world and with the digital application, and linking that back to whatever behavior change techniques or content that you're using, that you are hypothesizing to be the active ingredients to create change, right? So if you're using goal setting or tracking or community or social support, these different kinds of techniques or strategies that you hope will keep people engaged, will keep people moving towards meaningful outcomes. We want to make sure that we're able to measure these. And we think it's important to think about a couple key golden rules up front, which is to say, while engagement is important, right? Again, it is linked to outcomes. Outcomes can't occur if folks aren't using the engagement, or at least certainly there's not a causal chain between what you've put out in the world. And so saying we want to measure both, don't use engagement purely as a proxy for effectiveness. Let's look at measuring effectiveness and outcomes as well. We want to talk about testing the engagement throughout the development lifecycle, not just final product or effectiveness testing or even piloting or efficacy testing. When we think about digital design, we can test for outcomes or engagement earlier, even pre-prototype, right? Really understanding people's intentions in what kinds of techniques or content resonates with folks, right? UX testing. And also we want to, again, think about outcomes in addition to engagement. So what would we measure? There's lots that we can track, particularly when we start to use software services or platforms like Google Analytics or Adobe or Firebrand on mobile. What kinds of indicators might be well representative of engagement with digital interventions? And we think there's lots of things that you can track, that you might track, and that's great. We're here to add a little bit of, I think, structure and guidance to help you focus on different elements or analytics that you can use that are representative of engagement both in the real world and engagement within the digital application. And we've grouped those here. In physical activity, there is a nice rubric for thinking about how to classify behaviors, and we think it works really nicely for engagement as well. It's called FIT, F-I-T-T, and that is to say with a physical activity behavior, you can quantify that in terms of its frequency, how often something is done, its intensity, right? If you think about walking versus jogging versus running, how strenuous is it? The time or the amount that someone might be performing an activity, as well as the type, right? You know, again, the very, very specific type of physical activity. And we can apply that very nicely to engagement. When we look at what we can track, we can look at thinking about the number of logins over time, right? So how often do people log into your application or your service? Looking at very commonly, since in our world of behavior change interventions, there is a high amount of tracking either behaviors, either self-reported measures, or clinical measures, whether those are both active or passive. So looking at tracking and the amount of measures that people are entering. Again, context specific. What would that be? Could that be something like a glucose check? Could that be something like taking a pill, for example? Could that be nights slept, or whatever the context specific measures are that we're tracking, pain, levels of pain, using that as an indicator of engagement. Thinking about in structured versus unstructured interventions. We often see interventions that have a sequence or a number of modules or lessons as part of patient onboarding or patient education. So using the number of modules or lessons that individuals complete, particularly if you compare that to the total number or the percentage. And we can think about, even in more free-range interactions, the number of activities or goals completed, right? And these become measures of intensity. We can also look at the number of days, particularly looking at between the first login and the last login as a measure of overall engagement with your intervention. And we can look at things like time in app, particularly if we think about sessions. And sessions are very interesting on mobile applications. They differ from web applications, where we might see more frequent interactions, but shorter sessions. Even in the same intervention, you can see those kinds of patterns differing between if a person is using a desktop or a laptop, and that same person, that same individual, when they're out and about using the application in the real world, right? We have different engagement patterns. So we want to look at that and think about time and app. And again, we want to think about the kinds of interactions that people have. Are they engaging with active content, like answering questionnaires, filling out or tracking information, posting messages or engaging with the community, versus more passive engagement, reading, lurking, these kind of quieter behaviors. And then we want to know too, which specific content or features are being used by the patients that are engaging with our application. What this does is it allows us to look at creating a model for a dose response, right? If we can understand both for people that are successful, that have achieved outcomes, what are their engagement patterns like, and for individuals that have not yet been successful. What are their patterns? How do they differ? What are the people who are successful engaging with, and how often and how deep are they engaging with our application? So as a process, we can think about using whatever measures that we have to look at engagement overall. We suggest creating segmentation based on those engagement patterns, because ultimately there we can then begin to tailor the intervention, right? We know that one size fits all is not the optimal approach, but we can tailor the intervention intensity, the specific content to these different engagement segments to try to build that model of effective engagement, right? That dose response. Not too much engagement, not too little engagement, but the right amount of engagement at the individual level in order to achieve the outcomes that we're looking for. So if we use these different measures to build that model of engagement, we can also think about how to do that in terms of long-term engagement strategies with the development lifecycle. If we think about as we design products, from pre-prototype to maybe minimum viable product to robust prototype to final in the wild product release, we can look at a few different ways of collecting this data. We can start with self-report measures, even at the concept or paper prototype or screen design level. And we can use different questionnaires or interviews to understand a bit with our patient populations, to do that research about how people might adopt and or engage with the product that we're creating, right? Is it acceptable to the patients? What features or content resonates most with users? Have we taken an evidence base and applied it in a way that works for our intended audience, right? What are their approximations for what is interesting and how they might imagine themselves using it and how it may fit into their world over time? This can help us refine our design ideas to get to a prototype that we can actually test. When we have that testable prototype, we really want to look at how people are engaging, right? What's the reality? How can we bring patient populations in, let them use an MVP, even if it's only for a week, to collect that data, right, and see what's really happening. It may differ from what we heard in self-report, but we want to compare those two things, right? How are they using it? What content or features are they using? How often are they using the intervention? And what kinds of techniques are they actually responding to? So when we think about designing or using different engagement techniques, incentives, gamification, trackers, community aspects, what things are resonating and what things are being glossed over or skipped over, push alerts, notifications, things like that. When we have something a bit more robust, we want to look at a cross session. So we want to think about longitudinal studies as well, and how are users engaging over a duration of time, whether that's 1 month, 3 months, 6 months. Knowing that dropout is a great likelihood for interventions. We know that people think of interventions very often as something that they use for a while, hopefully to make the achievements or the goals that they want and move on. But we want to be able to study dropout as well. If we can contact patient populations and understand a bit about why or when they dropped out, that can again help us to refine the engagement model, refine our content, refine the product that we've built in order to get it ready for full-blown release. And here's when we think about things like, efficacy and effectiveness trials, right? Does the usage, particularly if we use control trials, RCTs, does the usage lead to more meaningful outcomes compared to either a placebo or treatment as usual or wait list or some other kind of comparator that's the right fit? Does using our intervention lead to those meaningful outcomes that we're looking for? Again, behavioral, clinical, psychological, quality of life. And between these different segments, how does usage vary by context? Is there a difference between app versus web, if that's applicable? Is there a difference between people who use something at home versus people who use it at work? How can we use this kind of information to further refine our interventions? So in a nutshell, we want to look at measuring as part of the strategy. We want to look at how different engagement patterns or people break into different groups based on usage. And we want to look at how we can map or marry those different usage patterns to the kinds of outcomes that we're hoping to achieve. Hayden?
All right. So that was a lot we covered in the past 40 minutes. And I think what our main takeaways, or what we've really gotten from pursuing this work and exploring this topic, that we hope that you take away from this, is to think about engagement instead of more being better. Think about effective engagement. What's the right amount of use that an individual will need in order to reach their goals and see positive outcomes? We also want to think about design for engagement as being multifaceted, right? Like multiple elements of someone's life, of the intervention design, of someone's context or condition can influence engagement in the moment and over time, and that's okay. You want to think about designing something that can accommodate for that variation. And then finally, we want to measure engagement early and continuously and look at both usage of the digital intervention and real-world behaviors and real-world outcomes in order to design effective interventions that result in positive outcomes for patients. I think we can all agree that that is something we care about and something that we want to center. So finally, to close out before the Q&A, we just wanted to acknowledge that a lot of this work has been informed by some really incredible researchers in the field. And if you have any interest in looking directly into the scientific literature around engagement, we highly recommend that you follow up with looking into Olga Persky and Blanford, Lucy Yardley, or Anna Weston's work, because there's some really amazing stuff to dive deeper in there that we would be happy to chat about as well. And I think that leads us to questions.
Indeed it does. And throughout the presentation, and great job, by the way, Dustin and Aidan, we've all heard and seen a lot of great information, and it can even be overwhelming a little bit, but we've only still scratched the surface on this important topic. So please make sure you send in your questions if you want us to go into greater depth on any of the issues discussed today. So it is time for our Q&A session, and that is always a popular segment of our web seminars. And we have a number of outstanding questions sent in from attendees, but you can still submit your questions. Just type your question into the control panel question area. And please note that due to time constraints, we may not be able to respond to all questions submitted live, but you still can contact our presenters, our experts, after the webinar too. So let's get to it, shall we? Dustin and Aidan, you'll be selecting from questions in the control panel, which were submitted by our registrants. So take it away.
All right, I think we got one good question here that we always love to answer, which I might toss to you, Dustin, which is, can you provide an example of a digital intervention that provided an outcome you didn't expect?
Yeah, I can quickly think about three at a very high level. It's always interesting to me when we think about designing interventions, very often, well, with digital interventions, we may be modeling the intervention on something that happens within a clinic and trying to take those ingredients and apply it. And those clinical interventions have outcomes. So it's always interesting to me when digital interventions either match the effectiveness of the clinical intervention, or they come really close, right? That's always a surprise. I typically expect the comparison of the digital intervention effectiveness to be low. So I always get surprised when it's close or even more so. And we've seen this happen with some work we've done with Joslin Diabetes Center and behavioral weight loss. So that's always surprising. I do think to point out to those curves or those patterns that Aiden talked about earlier, just from a engagement metric. We've seen in a few products, there's a nice study with a client of ours, the Truth Initiative, on smoking cessation, where the intervention has all kinds of behavior change techniques for helping cessation. It's got content to learn about it. It's staged based on where people are in their smoking journey, ready to quit, want to quit, and there's a community as well that people can interact with. Well, what has been shown in that study is there's also a phenomena of one-hit wonders. Folks who've come into the intervention and they've come in once, and then and never came back, and then during follow-up, they had reported quitting smoking. And you could say, okay, well, great. That probably happened outside of the digital intervention, somewhere else. They got what they needed. But when followed up in asking about it, the answers were directly reported back to the intervention itself. They found that one thing they needed, right? They found that they could get the emotional support. They found the information. They found content that built their resolve or their motivation to quit. So those kinds of one-hit wonders, I think, are always interesting. We've seen that in some stress reduction or resilience applications as well, where people come in, they may interact less than other people, but their outcomes are nearly the same. So to me, highlighting the idea of context, each intervention at each individual level is something that we want to look at and measure. Next question.
Let's see. This is one that looked quite interesting, which is, can you say more about engagement and lifestyle change behavior? And what is the psychological behavior change methodology in digital interventions for lifestyle modification?
Yeah, let's see. Wow. Okay, so if we think about, I'm going to frame lifestyle as things like physical activity, like nutrition, like sleep, maybe stress reduction as key behaviors. When we think about what kind of methodology or what kind of theory is underneath that, the answer is, well, it depends. But I think just broadly, a great way or a great framing to think about any interventions is there is a process that we follow. And that is to look at first, again, what is the overall problem that we're addressing, right? Are we changing lifestyle behaviors because there's a chronic condition that we're trying to manage, or is this prevention, or how are we framing the overall problem? We want to look at what kinds of outcomes, again, those outcomes. We start with the outcomes that we want to achieve: clinical, financial, well-being. We want to look at what behaviors from an evidence base are reliably linked to achieving those outcomes. So I'll take diabetes again. If we think about behaviors like nutrition behaviors, physical activity behaviors, even monitoring or checking one's glucose, checking feet, keeping doctor's appointments. These behaviors that are known to be linked to outcomes. We look at what barriers are known for each of those behaviors, and we map those behaviors to a model that we use here called the COM-B model that was developed at University College London. That COM-B stands for, really it says, for any behavior to occur, An individual needs to have the capability, that's both psychological capability, knowledge, skills, attention, physical capability, dexterity, strength, stamina, for example. They need to have the motivation, both from a cognitive approach to motivation, right? Do they have goals, intentions, plans, and an emotional aspect too? Are there negative emotional reactions to doing a particular behavior? Maybe it's to taking an injection if we apply it to medication adherence, or checking one's blood sugar, or things like that. Or have they built a habit, or are there habits we need to untie? So capability, motivation, and then of course within the person, and then of course opportunity. Does the person have a physical environment that is conducive to doing that behavior? If we want some, do they have access to resources? Is there a safe place to run if we're thinking about physical activity, or running, or walking, or bicycling? And does their immediate social environment support or thwart their ability? Do they have a support group? If they're trying to quit smoking, do people in their house also smoke, right? So thinking about those barriers as mapped to capability, opportunity, motivation, mapping that out for population or different segments, and then applying different techniques that are targeted towards each of those barrier sets, right? Again, if we think about smoking, we could make the argument that most people know that smoking is bad for them. So providing more information around the harms that smoking may produce may not be the optimal strategy. There may be something more aligned to going with the social circle. They're seeing people smoking. There may be underlying stressors or emotions or coping mechanisms that people are using smoking to overcome. So we want to be able to map our techniques and our strategies to those combi barriers. And then again, design it, implement it, test it, refine, so on and so forth. But very broadly, that's our process. We think about outcomes, target behaviors, barriers to that behaviors, techniques and content that map to those barriers, build it, launch it, test it, do it again. One more? We've got time for one more question. Yeah, so all right, so there's a question here about looking at engagement during clinical trials when a product is being used post-approval, and also a note that, yeah, in trials, engagement is probably higher. Yeah, what's awesome about, well, the pharma industry is, well, y'all pioneered the clinical trial method, and it works really well for bringing drugs to market, and it works really well for how we stage the design and evaluation of behavior change interventions as well, right? We follow that same kind of model from initial concepts or discovery all the way through, pilot, efficacy, effectiveness. So the question is, yes, there will be higher engagement during a trial than, real world. And what we want to think about is why that might be, I guess. And there's a few effects that we could talk about. One is, well, incentives. While it may be true that many products or services have incentives as a motivator in the wild, and we know those incentives work for the short term, very common in trials, so they'll get people through so they can get their incentive. Also true in the real world, but we know that incentives can be a particularly thorny issue once those incentives are removed. Very often, if people haven't found the value, internalized the behaviors, that engagement will go away, right? They come to see, even if they were interested, they come to see the reason that they're engaging is to get the incentive, even if it wasn't the original reason. And that means two things. You have to keep the incentive forever. You may have to increase the amount of the incentive as they attenuate to the value, and or you risk engagement when the incentives are removed, which is why in workplaces we have 3-month incented programs that you start over and over again, because by the end of that 3 months, people are tuned out, so you have to continue to refresh it. Yeah. So that's true in client and clinical work. Aiden, you wanted to say something.
No, I was just going to say, I think that's part of the great value and challenge and interest in designing for behavior change and effective engagement, right? It's figuring out how do you transition or help someone find an intrinsic motivation for a behavior or a self-sustaining motivation for a behavior that doesn't require that outside observation or that outside structure in order for someone to reach the outcomes that they want.
Yeah.
That was the thought.
Yep, and the idea too in the trials, you have something called the Hawthorne effect, which is by being part of a study, and people know or even feel that they're being watched, their behavior is different. And actually, what's interesting is we can see that effect even in pure, like just digital products as well. If people are assuming, we found that people feel, even if it's not true, they assume someone is looking at that data somewhere, and it can create that Hawthorne effect. So I guess the bottom line there is, yes, once you've launched, you should study engagement again. Don't consider it done based on the results of the trialing. Do another post-trial study, real world engagement, real world evaluation.
Okay, so once again, I encourage everyone in the audience to contact our experts if they have any additional questions. They really are interested in hearing from you if you want to talk more about this topic. So now, if you want to submit a question, just send an email to one of the addresses on the screen and put webinar in the subject line so they know what it's about. Well, we're just about at the end here. Any final thoughts or words of wisdom before we close up, Dustin or Aiden?
Yeah, I think just thank you very much for coming, and we're excited to see the increased interest in effective engagement as something that's being studied. And again, thinking about how can we use this approach, how can we apply this approach about mapping on-screen behavior to off-screen behavior and connecting it with the outcomes that we care about.
Yeah, and I'd encourage folks, if you have questions, definitely hit Aiden and I up. There's a lot more under this. It's part of what we do with our projects. It's also something that we teach in a longer format and workshops and things like that. And we're constantly looking at how do we get better at it, us and as an industry, period, and how can research and academia inform practice, so that we're all getting better at creating the tools that support patients in the way we want to support them. Yeah, thanks for listening.
Absolutely. So I hope everybody enjoyed this event and have taken away some new insights. I'd like to once again thank our friends at MadPow for partnering with us on this great event. I'd also like to encourage you to look for future web seminars by visiting pharmavoice.com. In fact, we'll be doing another webinar with MadPow in May, so stay tuned for that. Thank you for your time and enjoy the rest of your day. The event is now over.